So I'm telling you what's best for your gene to actually sing, to have the best expression that's possible. Looking at our metabolic structure
Hmm.
from a genetic standpoint and saying like, wow, okay, do you have a propensity to have certain diseases? But there's so much research about these herbal components. Think about this, over 500 medications have been derived from herbal substances, so we know the power of them. But I think when we start to look at, oh well, it's Chinese medicine. It's really not Chinese medicine. It's actually is world medicine. Because if you look at the history of acupuncture, where did it start? We found bones and sticks in graves like sort of carved down into needles where they were used, and we see markings of bones and things of that sort. Natural medicine is not something that should be feared. It's something that should be embraced, but also going to the right individuals that can lead you down the pathway to understanding your body, understanding your condition, and the fact that there's triggers that's going to happen, and we can stop those triggers from happening, thus allowing everybody to be whole.
So, Dr. Charlie, tell us more about you.
Question I always get, what does Dr. Ware do? Versus the acupuncture, the herbology. I'm the CEO of Healing Blends Global, sickle cell expert, functional medicine. But my joy, because I'm a nerd, as I always say, is really about understanding the genes, the epigenetic, the epigenomics, and also the microbiome as well. I say I have a lot of tools in my tool belt to make sure that when I have a patient come through, I'm not just looking at the symptoms. I quickly want to understand the causality of whatever's going on. So whether it be a chronic situation or a genetic situation that I'm dealing with, I want to get to the root as fast as possible, and also the easiest and the least toxic or hindrance to whole health as I possibly can. So that's how I come up with my treatment principles and also my long-term care plans for my patients.
Okay, guys. So, do you see why he was selected? We hand vetted who we wanted to be a part of this because we wanted people that had really poignant information to share that you don't usually hear. Dr. Charlie wears so many hats and has so much areas of expertise. And we know that if you want to get relief from whatever you're undergoing, whether you're a beginner on your journey, or even if you're someone who's more seasoned in this journey of healthy living and a healthy lifestyle, there's still so much for us to learn. And so he's going to be giving us so many great tips and information. So I'm just exuding excitement right now because every time I talk to Dr. Charlie, I learn something new and I get even more excited. So I want that for you. That's what we're going to do today. So you have so many specialties.
Yes.
Let me tell you, when we spoke the first time, you mentioned the first things, the acupuncture, you mentioned the herbology, but then at the end, you mentioned gene therapy. And I was
Yes.
like, gene therapy, that's a new concept for me.
Yes.
And I would love for you to just go into that a little bit, because I think that might be a new concept for a lot of us that are watching.
Yes.
What that means.
The whole gene aspect of understanding the whole genome. Once they mapped out the entire genome, it wasn't much else for them to do because they're like, okay, we see where it is, but how can we make this functional where we are either developing medications behind it and other therapies? There was a portion of it that came to light that most people just didn't understand was the epigenetic aspect or the phenotypical aspect of what the gene is going to do. So that's where we really study and really are able to manipulate our genes. So when I tell someone about their diet, I'm like, listen, I'm telling you what's best for your gene to actually sing, to have the best expression that's possible. It can be, this is a great story. So of course, my entire family, I've done their genome. So my wife, Italian German background, myself, Native American, Caribbean American, African American background. So our kids are just a hodgepodge of everything. We have 4 kids. So looking at what I needed to have my daily intake of just nutrients. I've been vegan and vegetarian for over 30 years. And when I did my genetic code, it actually aligned it almost perfectly. I only need like between 8 and 10% of my daily intake to be protein.
Wow.
The rest were healthy fats and also carbohydrates, fruits and veggies.
Mhm.
These are things that we can actually look at when we're looking at your entire genome. But one aspect of it, my wife, 70% was protein. She needed 70% of her daily intake of nutrients to be protein. And then it was healthy fats and also carbohydrates.
Oh, this story is so good.
So it was amazing. So then looking at our kids, they are a great mix. Like, my my boys are like my wife. The
Uh-huh.
girls are like me. And my daughters are mostly vegetarian. They eat
Mhm.
fish and whatever. But my boys are carnivores like their mom. So that's just one aspect of looking at or the information we can deduce down from looking at your genome and how to elicit certain things from it. Another beautiful thing amongst things was looking at our metabolic structure
Mhm.
from a genetic standpoint and saying like, wow, okay, do you have a propensity to have certain diseases,
Mhm.
like type 2 diabetes? And my wife, as she ate incorrectly, had I think it was around 75 to 80% chance of having type 2 diabetes if she did not eat according to that. And lo and
Wow.
behold, unfortunately, my father-in-law, passed away last year from metabolic disease.
Mm.
So, it's these things are so important to understand, but it's many things we can look at. We can look at athletic performance. I have a lot of athletes that come to me for this athletic performance,
Mhm.
your mental health, your gut health, your hormones. It's about 15 to 16 different panels I run to sort of say, what are your genes really dying for? For me, I love looking at sleep in people. People, aren't realizing that
Mhm.
the genetics of sleep is so important. There's over 52 genes we look at just to see how well you should sleep.
Yeah.
Whether it be how long, the onset, the duration, the quality of sleep, all those things are factors when we look at the genetic components of it.
This is such a great conversation because the first time I spoke with you, you
Mhm.
mentioned that story about your wife and your children and how you all
Yeah,
measure different
yeah,
when it came to how to eat. And I've had this conversation now with numerous people just because of that,
yeah.
because we see a trend where people see a food trend happening and they
Mhm.
feel they gravitate to it.
Yeah,
Instead of listening to their bodies,
exactly.
they're going with what's trending and it's not working for them
Yeah,
because it's really not how they're supposed to eat.
not at
But
all.
who knew that you could actually take a test
Yes,
to figure out how you should be nourishing your body? I
exactly.
absolutely love that.
Yeah.
So instead of going out there and jumping on the next trend
Mhm.
or guessing how you should be eating, whether you should take out the protein why don't you go get gene tested
Yeah,
and know 100% what
exactly.
your body wants to do? That
Yeah,
is amazing. Okay, I'm so glad we touched on that because that is just so eye opening.
yeah.
Okay, so tell me how you got started. I mean, you have all these things under your tool belt,
Ooh.
but where did you start? Was it in acupuncture? Was it in
I would say even before then,
Okay.
I grew up on a farm, in Virginia.
Mhm.
So the closest hospital was an hour away.
Oh,
So
country.
yeah, country.
Yes.
Um, you know, uh, the first time I went to McDonald's because that was also an hour or so away. It was always weird. So we ate at home and things of that sort. So, and I found that at a young age, when
Mhm.
my parents finally told me that I have sickle cell beta thalassemia. Sickle
Oh,
cell is a genetic red blood cell condition where my cells are sickled or flat, and I don't carry enough oxygen throughout my entire body, which is fine. I'm okay. However, when I at that young age, when I would go through a pain crisis, when the cells was it clogged up in my veins and arteries, the pain is excruciating. Is like some women would say, I prefer to go through labor than a sickle cell crisis. That's how
wow.
bad it is.
I've seen it.
Yeah.
Yeah.
So when I would go through a crisis, and it was nothing to give me,
Mhm.
realistically, pain medication, whatever. But my grandfather, Native American, always had these weird herbs and things growing. So he always just give me this limits. He would rub on my body. So I was natural for a long time,
Mhm.
because of what he did. And what really changed my life and sort of really wanting to get into this medicine was the first time I actually took an analgesic. I was about 8 years old. My mom brought me home from school. She said, "You got to take this." All right, fine. I took it, was laying on the couch. And within like, say, 15, 20 minutes, my mom was flying around the room. Like,
What?
I was
Oh
hallucinating.
my gosh.
So, and it was in that moment I said, I never want to experience it ever again. So that's one
Wow.
reason I never done any drugs, anything like that sort either, because I was like, oh, this is weird.
Yeah.
So in that, that sort of like was sort of rooted in me that I want to be a healer.
Mm.
Even going to college, even going to, I was accepted to medical school. Ultimately didn't go. I went to Eastern medical school, like
Mhm.
acupuncture and, functional medicine, things of that sort. And even there, I was always trying to find a solution for sickle cell disease, or just have people just live as best as they could. So that was my journey. So it started from there. And then I've always had a research component. I've always done research. That's when I started making my supplements for sickle cell disease. Formulated my company for that and getting that double blind tested all over the world, Kenya, Nigeria, Canada,
Amazing.
Uganda. So when we got the information for that, we just started to, want to really spread that to as many people as possible. And then as a practitioner,
Mhm.
always wanted to go deeper. I started to get more into the functional medicine aspect, and I didn't want to just do testing on people, or more tests, more tests. I wanted to go deeper, as deep as I could go. And that's when about maybe 12 years ago, the genetics and epigenetics, thing really started to come about. And I
Mhm.
was really the one of the first and second classes to go through the school I went through for that as well.
So good. I'm so glad that you kind of put medical school on the back burner and
Yeah,
went into the Eastern medicine side because
yeah,
those are practices that people have been using for thousands of years
thousands.
and they work.
It's so much research. I think the fallacy with natural medicine is that we assume that it's not researched. It's
Mhm.
so well researched. Especially if you look at a country like Japan, in order for you to get an herbal formula in Japan, you have to go to a pharmacy to get it. You have to get a prescription to get herbs.
Mhm.
They understand how powerful they are. They're regulated by their government and everything. And other countries are sort of the same way. But there's so much research about these herbal components. Think about this: over 500 medications have been derived from herbal substances.
Exactly.
So
Yeah.
we know the power of them. But I think when we start to look at, oh well, it's Chinese medicine. It's really not Chinese medicine. It's actually is world medicine, because if you look at the history of acupuncture, where did it start? In Africa. We found, bones and sticks, in graves, like sort of carved down into needles where they were used, and we see, markings of bones and things of that sort. Yes, yeah,
Really?
started in Africa. So it is something that just transmigrated.
Mhm.
I always tell people, that's the thing about this. First time you hit yourself, you hurt yourself. First thing you do, you grab it and you rub it. That's the acupressure, aspect. That's where it started. Things of that sort. So these things have been researched over and over and over and over again. Is really about understanding the engine and the force behind it. If I can tell you to drink a herbal tea, or to have a classic thing I drink every morning is I drink turmeric, ginger, lemon. I put thyme, sage, basil, and rosemary inside of it. There's a reason behind all that. One, anti-inflammatory, and two, I'm waking my mind up, waking my brain up,
Mm.
right? So, and if we told people to do that, the dementia, the Alzheimer's, the inflammation inside of your joints would be decreased. But there's no money in that, right?
Mhm.
Unless I make it say, hey, you got to buy only for me. But if I'm going to tell you to take, a medication that's supposed to help you with joint repair, it doesn't do that. It's going to do more damage. There's money in that. There's an engine behind
Mhm.
that. So that's why we sort of poo poo um, um, natural medicine, because there's no money in it.
Exactly. So, I hope you guys wrote down
Oh,
that tea recipe because you should start incorporating what Dr. Charlie is doing,
yeah,
right?
yeah.
We want to do what he's doing. So that is so good. So my parents are Jamaican
Mm,
and I grew up knowing that herbs work
yes,
because whatever was growing in the backyard, if you had an ailment, they'd be like, oh, go boil this. And it would
yes,
work almost
yes,
instantly. It would
yes.
smell terrible and
Yeah,
taste terrible,
yeah,
but it would be very effective.
exactly.
So I've just coming from that background, but I will say I feel that maybe there's a disconnect with people that aren't from maybe more rural areas in the US or from another country where they use, more natural ways to
Mhm.
help to heal or to medicate. And so they've really been taught only one way, which is what we see everywhere, the pharmaceuticals,
Yeah.
and there's so much more out there.
Yeah.
So you also mentioned, so with I will share how acupuncture honestly changed my life.
Oh, yeah.
I'm going to share this story real quick.
Yes.
So I had an allergy that I used to have as a child, and it reappeared in my 40s. I think because I got in a car accident, I was going to chiropractor, might have just kind of, set things off in my body. But I have very random parts of my face would swell up.
Yeah.
And because I'm constantly in the public's eye, that was not a good thing. So I would have a big event. All of a sudden, my jaw would be this big, looking like someone just punched me in my face, right?
Yeah.
So I was going to an allergist for 3 years.
Mhm.
For 3 years, going to the allergist, they told me, we don't know what it is. It's idiopathic, which means they have no clue.
I have no clue. Yes.
Pretty much is telling me they have no clue, but still telling me to come back.
Yeah.
Does it make sense?
Yeah.
3 years, guys. So I didn't know much about acupuncture. All I really knew was the needles. And I was always kind of scared of the needles until one day I saw a friend of mine talking about allergies and going to our friend who was an acupuncturist. And I said, I wonder if he could help me. And I reached out and he's like, yeah, come on over. I go to him. And within the first 10 minutes of our meeting, he figures out my allergy, which took 3 years for them to tell me they didn't know what it was. He figures out in 10 minutes. Yeah. And I was blown away. And from then, and it was not invasive at all. No. Muscle testing. Yeah. I mean, it was incredible. Yeah. And from there, I have become such a believer of acupuncture because I've seen what it's done for me. And then he shared the natural, what do you call those? Homeopathic medicines you can get from Whole Foods and all those.
Exactly.
Amazing. Yeah. So I say this because I am constantly educating people now on what acupuncture is because they were like me. They just thought it was, I'm going in to get needles put in. I don't know if I want to do that. And I'm like, it's way more.
It's way, way more. And the one reason why I'm still here in the state of Florida is the fact that, Florida has a very, very wide scope, So I'm a primary care physician here in Florida. People don't realize that as an acupuncturist, you are a primary care physician. I can order any test I want as well. And I do order tests all the time for my patients. Sometimes I'll run a CBC, CMP, whatever. But the thing with acupuncture is not just the needles. It's deeper than just the needles. It's the herbs. It's the palpation. It's the talking to a patient. So, I wasn't a huge talker. I'll be honest with you. I wasn't at all. But when I start to really get into, natural medicine, you have to understand the person. You have to understand all their habits. People don't realize that, hey, what you drank, what you ate, how you slept, your emotion, when you were born. I mean, all this stuff is so important to your overall health. And I mean, even being around electrical equipment, constantly, it has a bearing on your health. Even before you came in here, I was asked, you want to come inside the studio? I said, no, I'm going to have some natural light on my body a little bit longer. Because all that stuff matters. So when we're asking, these questions, we're trying to, again, uncover every part of that onion as we can to get to that centerpiece, that person who you are. And a lot of times I have people who just like, Michelle was like, oh, no, that's not a big deal. Like it was a big deal. That's causing you allergy, that's causing you inflammation. I have people who come in all the time like, wow, you have this constant back pain. I said, okay, do you defecate every day? They're like, a couple times a week. I'm like, oh, that's nasty. But your back pain is being caused because you're chronically constipated, and then you're causing inflammation in your pelvic floor. Where's your back muscle located? In your pelvic floor. So let's have you go to the bathroom on a daily basis, and your back pain is going to happen. Have to just go away. So simple things like that,
good. This is what I love about practitioners that practice more on a holistic side because they make the connections, right? A lot of times we go to what we call traditional medicine, which I don't know. I hate to call it that because I don't feel like it's traditional. No. I feel like natural medicine is the traditional way, but they don't connect the pieces. They will diagnose you based on one part of what's happening in your body, and they won't connect it to all the other. We're one person, one
Yeah.
being, and we're all connected. And just like how Dr. Ware just connected your bowel movements to your back pain, to your,
Mhm.
like, I
Yeah.
love that. And that's what you find a lot of times when you move over to a more natural way to diagnose your issues.
Yeah.
You get to the root cause of
Yeah.
the issue.
Yeah. The thing that we have is a lot of individuals will come in with a diagnosis, and will have a blank stare at my face, and they're like, You're not alarmed that I have?" I'm like, "No, because that diagnosis isn't you."
Mhm.
Whether it be, I'll say the C word. I can't treat the C word technically, but if it's a C word, if it's a gastrointestinal issue, a great thing with a story with rheumatoid arthritis, I had 3 or 4 patients with rheumatoid arthritis diagnosis. And I was like, okay, so they are all on the same medication. But one was because of the fact they had a wheat and dairy allergy. So it was causing inflammation in the joints.
Yes.
Another one was having issues because she had sleep disturbance. So she had a metabolic issue causing inflammation inside her body. Another one was, he was a machinist. So he was constantly on these machines.
Mhm.
Another one, he was in front of his computer all the time. But they were all the same diagnosis, but they all had different reasons for having it. Take
Right.
away those issues, what happened? The joints are not inflamed. So it's really about understanding how to look at these individuals as I keep saying, they're individuals. They're not a diagnosis.
Yeah.
I recall being doing rounds. 'Cause I used to do ground rounds at a local hospital. People would send me their difficult cases, so I do grand rounds there. So and I got in an elevator, and these physicians were talking, and they were like, "Okay, I have all these diagnoses that I'm seeing today." I'm like, those are individuals. There's one diagnosis. So that's the thing with the traditional medicine. And
Yeah.
actually, this is the only country they call Western medicine traditional medicine. Every other country calls traditional medicine like the herbs and things of that sort.
Right.
So, but with allopathic medicine, this is what we look at. We chase the symptoms until we have no other thing to chase.
Mm.
And say, okay, well, try something else out, or let's reset everything and start you back over again. Like with sickle cell disease, we have individuals on this harsh medication that's really for cancer or for tumors, but it does one thing: increasing their hemoglobin. Thus, theoretically, it should decrease their crisis rate, and over 85% of individuals have severe side effects to it. So it really doesn't work that well. However, they know that it's going to increase their liver enzymes, decrease their kidney functions over a long period of time. So they have to come off of it. So what's the solution? They increase their pain medications. They
Mm.
increase the Suboxone. They increase the morphine, and now you have these individuals are in this realm of only relying on medications versus relying on eating well, sleeping well,
Yeah.
drinking properly, and also moving their body. So that's what we take individuals through. Like I developed a method called the Sozo method. Sozo in Hebrew, in Greek, actually means to save from suffering, to heal in every way possible.
Mm.
So that's why I used to love that saying, Sozo. But is a four pronged method where I'm looking at your sleep, I'm looking at your diet, I'm looking at your stress management, and also looking at how well you're moving your body. If we are able to connect all those things and have you do all those things well, the disease is going to move from your body. A few years ago, I was part of a group that we wrote a book called The Code of Longevity. And my part was looking at the bioactive nutrients that, again, allow the genes to express themselves properly. What did we find? Traditional medicine,
Mhm.
herbs were the best thing for the body. It wasn't just me saying it, that's what the science says. Individuals that lived in areas where they only ate, protein and root veggies versus, having the herbs around the sea life and things of that sort. Their brains grew at different rates. Their knowledge
Mm.
base grew at different rates as well, and they evolved to be more healthy individuals. And this is over like millennia, not just over a 10-year period. It's over millennia. We see this, So it's so important for us to understand natural medicine is not something that should be feared. It's something that should be embraced, but also going to the right individuals that can lead you down the pathway to understanding your body, understanding your condition, and the fact that there's triggers that's going to happen, and we can stop those triggers from happening, and thus allowing your body to be in whole health situation. So that's what we do here.
Are you guys fired up? I'm so fired up. I want to talk to Dr. Charlie all day. Unfortunately, I can't. But what I do want is for him to leave his information so you can reach out to Dr. Charlie. And can you see patients outside of Florida, like
Patients all over
virtually?
the world.
Oh, that's what I thought.
Yeah,
He
yeah,
travels the world. We
yeah.
didn't even get into your worldly travels. Oh my goodness.
Yes.
He talks in different countries in Africa. He was just in Jamaica doing a symposium. Like, this is a man that you want to connect with if you really want to see change happen in your health,
Yeah.
because you just have so many, like you said, tools in your tool belt to help so many people.
No, thank you.
And I'm so proud that you're also a member of our Holistic Business Network, because these are the kind of resources we want to give to you to make that change.
Definitely.
So please tell us how people can reach you.
Very simple. At my website, drcharlieware.com. All my information is there. You can book your appointments for gene therapy, whether it be microbiome testing as well, and then just regular conversations, because sometimes you have to have a discovery call, see why you want to have a conversation with me as well. But yeah, that's on IG and drcharlieware.com as well.
You got to follow him on IG. He's so good.
Yeah.
He gives so much great information. You'll get a lot of value just from his IG alone, but reach out to him because, there's so much more individually that you'll be able to get, right? You need that individual conversation.
Definitely. Like I was talking to a patient in Gambia just yesterday. Yeah. Also Sweden too, because I had several yesterday as well. So it is just different ways for us to connect. And for me, I'm just the facilitator of your health. You have to do the work, and I love when individuals really buy into the concept of being empowered for your own health. So when you do that, your health is going to thrive.
Thank you, Dr. Charlie. Thank you for being a part of our first relief retreat. It was truly a pleasure having this conversation with you. And, I just can't wait for more people to be able to connect and learn and find ways to improve their health. So thank you so much for all that you're doing, not just here locally, but around the world. You are definitely making a difference.